We're joined now this morning by Muthana Sartawi, an orthopedic surgeon with Christie Clinic. Good morning.
Good morning.
All right, so we're talking a little bit about knee and hip issues as we age. How problematic, though, are our knees and hips as we get into our golden years?
I mean, arthritis is associated with aging, and we're seeing it more common now, especially in the younger population and obesity. So it's definitely prevalent, especially in the United States. I'd say the numbers are almost 40% of patients who are above 55 years of age suffer from arthritis, whether it's hip arthritis or knee arthritis.
And these are problems that, I mean, not only could be painful, but this can really impact trying to live a healthy life and a well life as you get older, because you won't be able to move.
Correct. I mean, it's debilitating. Patients are not able to perform their activities of daily living. They're in pain with every step. And fortunately, we have a solution to this, which is a hip or knee joint replacement.
And there's a new approach to doing these. Tell us a little bit about that.
Correct. The traditional approaches require the surgeon to cut the muscles and tendons to perform a hip or knee replacement. Patients tend to have more pain and the recovery is much longer. With these newer techniques that we're introducing, patients have less pain and recover much quicker.
Okay.
Who should be thinking about these types of treatments? Who's recommended for these?
Patients with advanced hip or knee osteoarthritis that have failed a course of non-operative management are good candidates for a hip or knee replacement.
Okay, we've got some videos that kind of show some of this new techniques, so we're going to go ahead and bring those up. And we're just going to have you kind of walk through some of these different techniques. So you're mentioning that the recovery time is better, which is, I think, what most patients would be really focused on here.
Correct, because with these techniques, we spare the muscles and tendons as opposed to the traditional techniques. So, I mean, this is a patient day one. She's up and walking. This is a patient in the operating room table, already able to fully have full range of motion. With a traditional approach, it takes almost 6 weeks to 3 months. Minimal pain, and he's not even up yet. So this is all because of the muscle sparing technique that we use. This is another patient the morning after surgery. I mean,
wow.
You can't even tell which knee was done. He had a knee replacement and he's already walking like he walked before when he was younger. So I think with sparing the muscles and tendons has a huge impact on the outcomes, and patients are back to their active lifestyles much quicker. And this is the same patient, again, as we can see. He is achieving almost full range of motion, which with the traditional approach, as I mentioned, takes up to 6 weeks. And this is day one, and he's already there.
So why is it with the, so how do you do this? I mean, how do you spare, you know, those muscles? And I guess the next question would be why haven't they done this since the beginning?
Well, I mean, obviously with a lot of training and studying, and these techniques have been recently invented. I trained at Rush University Medical Center, and we pioneered in the minimally invasive surgery, and those are the techniques that I'm bringing today. So they're more recent, and we've seen with studies that patients, as you can see from the videos, are in the hospital one day, if not the same day discharge, as opposed to the traditional approach where they're in the hospital for a few days and recover either using a cane or a walker up to 6 weeks or 3 months. I mean, as you can see with the videos that we showed, these patients are up on the same day of surgery, not requiring a cane or a walker.
Are the patients surprised by how quickly they're up and moving after this surgery, or are they kind of reluctant to almost get up and do that?
That's a good question, and very much so, actually, because they hear it from other patients who've gone through the traditional approach, so they're prepared to be rehabilitated for 6 weeks. So I don't tell them, but the next day after surgery, I mean, they're up and walking, and they're very happy patients. I've tried both approaches in training, the traditional approach and these newer techniques, and the satisfaction rate from these approaches is much higher.
Is the longevity of the replacement just as good as with the traditional approach?
Yes, it is, because with these approaches we spare the muscles and tendons, but we can still have a good view of how we position our components and position them safely.
So today is all about living longer, healthy living. So how is this surgery really promoting that better lifestyle as we get older?
With the traditional approach, just because of the pain, patients are immobile for a much longer period of time. And we know from research in medicine, pain and immobility has a negative impact on the human body and a patient's psychological well-being. So with these approaches, since patients have minimal pain and they're up and walking day one, they tend to go back to their active lifestyles and heal much quicker than the traditional approach. So intuitively, they're much healthier.
Very good. And as a reminder, not every patient will qualify for this kind of surgery, so who would be best suited for this?
Any patient with osteoarthritis or arthritis in general that has failed a course of non-operative treatment is a good candidate. The patients that I tend to delay surgery on are patients who are morbidly obese or who have a body mass index of above 40. This goes to traditional or these newer techniques because the studies in hip or knee replacements has shown that this group of patients has a much higher complication rate than the standard population.
Okay, very good. It's an amazing video. I just want to keep watching it. That's awesome. Thanks so much for joining us and telling us about those new techniques. We appreciate it.
Thank you for having me.